Welcome. It's my great pleasure. I'm Joe Keenan. I'm the president of the board of directors for NAMI New Hampshire. I'm way up here in northern New Hampshire, up in Coos County. Um, and it's my great honor, really, to chair this meeting and to open up the meeting and welcome all of you to being here. We really appreciate your participation, and we hope to have a really interesting hour. The session will be recorded, and the recording, as well as the resources that we discussed during the meeting, will be emailed to all registrants. So you will get something in the email afterwards with the resources we discuss. Uh, if you have questions as we go along, the questions can be shared at any point. Feel free to enter the questions into the Q&A section, and we'll try to see if we can get to them as we go along. As far as what we're going to try to do in the next hour or so, um, we're going to discuss NAMI New Hampshire's statewide work in 2026, what's coming up this year, the general legislative priorities for mental health in the state, and suicide prevention in this upcoming legislative session. Um, we're going to discuss specific bills for you to watch as we go into the session, take your questions, and try to drum up great enthusiasm for the task ahead. We've got an interesting year, and we want you all to stay involved and actively engaged. So, without anything else to say, I'll just turn it over now to our stellar executive director, our fine executive director, Susan Stearns. Go ahead, Susan.
Well, thank you, Joe. I appreciate that introduction. You're most kind. Um, Welcome, everyone. We're really glad you're able to join us this cold January night as we talk about the year ahead. So with that, we'll get started with our slide deck here. So welcome to NAMI New Hampshire's 2026 virtual town hall. We go to the next slide, please, Sam. So just a reminder, folks, NAMI New Hampshire is a grassroots organization working to improve the lives of all people impacted by mental illness and suicide through support, education, and advocacy. We remain stalwart in our working towards that mission. I won't read our vision here, but it remains unchanged. Next slide, please, Sam. I want to give a little lay of the land here in terms of as we move forward tonight. Just a reminder that here in New Hampshire, like across the nation, 1 in 5 adults experiences a mental illness each year, 1 in 6 kiddos similarly. And we know that we have 1 in 20 adults who have serious thoughts of suicide each year, and 1 in 9 adolescents as well. And I say that because I'm preaching to the choir here, but it's really important that we continue to share this message that mental illness and suicide, these are issues that truly impact all of us. We all know someone, it may be ourselves, and it may be someone we love dearly who are impacted by mental illness and suicide. Next slide, please, Sam. And as we think about our work going forward, this is information from the New Hampshire Youth Risk Behavior Survey. I actually want to pause here and I want to mention that we owe a great debt of gratitude to Governor Ayotte, who in the last legislative session last year vetoed a bill that would have made the Youth Risk Behavior Survey what is called an opt-in, which would have required that for every student to take it, they would have had to have a parent or guardian sign a permission slip for them to participate. Currently, it remains an opt-out, so a parent or a guardian can choose that their child does not participate. But by preserving its opt-out status, we have ensured that we will continue to get data that is statistically meaningful, and it's really important so that we know what's going on with our youth. I'm going to tell you, you're going to hear that there's another bill trying to do that again this session. So stay tuned. There'll be opportunities once again for us to try and ensure that this critical tool remains accessible and gives us this information about our young people. As you look at this, I want to particularly draw your attention to the purple versus turquoise bars, those being the data from 2021 and 2023. The survey is administered every 2 years. We don't yet have 2025 data. But what you see there is, in terms of youth who felt sad or hopeless, we in 2021, so sort of the height of COVID, we were seeing that at 44%. And then in 2023, that came down to 39%. Similarly, in terms of, we've seen that similar decrease with youth who have considered a suicide attempt the past year, as well as those who've made a suicide plan, and even that small decrease of those who attempted suicide in the past year. So we remain hopeful that the data will continue to show this difference between our COVID years, where those numbers really shot up and were really concerning. They're always high, always concerning, but really were dramatically concerning during COVID. So we hope that we continue to see that improvement. Next slide, please, Sam. And this is a slide that speaks to, again, from the Youth Risk Behavior Survey, also called the YRBS, that just speaks to our lesbian, gay, and bisexual youth, as well as a group other questioning. So it did not include questions for trans youth. I want to point that out. And here we see that these numbers are even higher in these categories. So we have our trans youth at about 60%. We're feeling sad or hope. I'm sorry, not trans, LGB youth. Sorry, feel it at 60%, feeling sad or hopeless. 40% having seriously considered a suicide attempt, and 32 having made a plan, as well as a 15%. I see a little bit of a drop there again in these numbers as well, but 15% having attempted suicide. We know our LGB youth are, at greater risk, likely due to, frankly, the discrimination that folks who are in the LGB community can experience. And I would remind people, as we have these heated conversations, that the rhetoric really is heard by our young people, and it is impactful and not in a positive way. So I ask always that people temper their remarks and remember who is listening. Next slide, please, Sam. So just a reminder, NAMI New Hampshire is 1.5 years into our 3-year strategic plan. This is our guiding document, and we really actually, as an organization, use this every day. Our work is, we see where it ties back to these goals. Pretty much everything we do, and we collect the data on that as well. So just, again, not going to read the whole slide, but a reminder, we have these 3 big goals. First, to advocate for increased access via systems transformation. Second, to optimize prevention and early intervention, education, training, and services. And then 3, to ensure our staff and volunteer capacity. NAMI New Hampshire, we have some 53 dedicated staff members and over 200 statewide volunteers. And thanks to all of you, we served over 54,000 folks last year. So when we talk about our workforce, we're talking about our staff and our volunteers here at NAMI New Hampshire. You're the ones who do all the good deeds and help folks hang on to hope every day. So thank you. Next slide, please, Sam. And then tying back to goal 1 there around systems access and systems transformation, emergency department boarding is an issue that has been plaguing our state for well over a decade. Indeed, it has been really NAMI New Hampshire's primary advocacy area in many respects since 2013. And so this is just to give you a sense of recent data in terms of adults and children. You'll notice the adults are broken down sometimes by those who are subject to an involuntary emergency admission in an emergency department, those who might be in a jail, and those with other legal statuses, often a revocation of a conditional discharge. So someone who's previously been hospitalized under an involuntary emergency admission, and then our kiddos. So you will see, we are seeing some fluctuation in those numbers. But I do want to point out that we have, for the last 3 years, been part of here in New Hampshire. New Hampshire is a member of the Mission Zero Steering Committee. Mission Zero is an initiative to end emergency department boarding, and it is showing real signs of progress. Next slide, please, Sam. So this collaborative effort is led by New Hampshire's Department of Health and Human Services, and I have to give full props to Commissioner Lori Weaver, who has really been the one to sort of grab this bull by the horns and say, let's get it done, and brought together all the partners to work on this endeavor. And really doing so through three main drivers, and that being the front door, which has included things like additional crisis stabilization, additional crisis resources, shoring up our community mental health centers, helping them become certified community behavioral health clinics, which is a no wrong door, fully integrated service model. And that we've got 3 that are currently certified as CCBHCs, as the acronym is in the state. And then that sort of inpatient supply coordination that really refers to the beds. So, and how we get people into them. And again, immense amount of collaborative effort. New Hampshire Hospital, all of its units are open, full capacity, 185 beds. Dartmouth has brought some additional involuntary beds online up at Lebanon. And then the partners here have worked tremendously on what is called care traffic control, which has made a significant difference in how quickly people get from an emergency department, and these I'm talking about adults subject to an involuntary emergency admission, how quickly they get from an emergency department to an actual acute psychiatric bed at a designated receiving facility. And that care traffic control has made an enormous difference. We have seen wait times decrease, where we were well over 3 days to being close to 1.5 days now as an average. We're not done. It's too long, but we are seeing significant progress. Finally, backdoor issues. So, the back door is really where we talk about folks who have had that acute psychiatric treatment in a hospital and are clinically ready for discharge, but they don't have anywhere to go. For example, New Hampshire Hospital, 185 beds. On January 11th, and I will say the data has gotten much better, so I'm able to tell you, on January 11th, they reported 101 people out of 185 beds were clinically ready for discharge, and they didn't have anywhere to go. So we know that we have a big problem there at the back door, and we know we need to be doing more. There has been effort through progress with Mission Zero, with things like landlord incentives, additional transitional housing, other community residences. But with the budget that was passed in the last legislative session, there was no additional funding put in there for those things. So we need to continue to advocate for housing, permanent supported housing, step up, step down programs, transitional housing, all of it. We need to have the whole array, and we need more of it in our state. So when people may say, we have people boarding in emergency department, we need more beds. It's what kind of beds? We don't really need acute psychiatric inpatient beds. We need those beds that help people get back out into the community where they can live a full life. I do want to point out that in the past year, as I said, Mission Zero has been underway for 3 years, and it was in December of 2024 that we first got to zero for adults boarding. And over the past year, in 2025, we have had 10 different days, and these numbers are reported daily, where we have had 0 adults subject to an involuntary emergency admission petition boarding. By comparison, between 2017 and 2024, there were a total of 8 days. So we are seeing tremendous progress here with Mission Zero, and we need to stay the course. Next slide, please. So you may have heard, actually, as I think about, I want to make mention of the kids, and Mission Zero has just expanded its scope to include kids. So I don't want to not call that out And again, all the partners of the Mission Zero initiative agreed that it was really important, as Mission Zero has come into fruition and been implemented, that we bring the kids into that focus. So that has just begun. And so stay tuned to hear more about that. You may have heard that New Hampshire has just at the very end of 2025 been awarded a large grant by the Centers for Medicaid and Medicare Services called CMS. This is a federal grant. The first year is $204 million. And this is the first year of 5 years of funding. This is a real opportunity, certainly for our state. And this is rapidly moving. The state will have to submit its final budget by January 30th of this year. And the first year of grant funding, this $204 million, is meant to be spent cover the year ending in October of 2026. However, this first year of funding, they are allowing each state, every state got one of these, varying amounts. New Hampshire actually got the largest of all the New England states in terms of awards, but they will have a little more leeway for this first year. But this works a little differently than other federal grants. The subsequent years of funding will be dependent on how states meet their goals and how quickly they expend those funds, because funds could be reallocated. So this is going to be a rapidly moving project, and it is being led out of the governor's office through something you may hear called Go North, which stands for the Governor's Office on Rural Transformational Health. I will tell you, NAMI New Hampshire provided input when the state was doing their application, and there will be what's called rural governance groups with stakeholders that will help with this project rolls out, but it will move pretty quickly because of those constraints from the federal government. So while this is a wonderful opportunity, it does arise from that One Big Beautiful Bill Act that was passed last summer, and in part to try to offset the loss in federal Medicaid dollars that states will experience. So I'm going to turn things over to Holly Stevens, our Director of Public Policy, who will talk a little bit about those changes to Medicaid and then go on with our policy work.
Thank you, Susan. Yes, as Susan mentioned, the Rural Transformation Grant funds were provided to states to offset the large amount that's going to be lost due to these Medicaid changes. There are big changes on the horizon, and we know that these changes to Medicaid can be anxiety-provoking, and they can be downright scary. And we are here to bring you what we currently know about the situation. There are changes happening on both the state and federal level. With federal H.R. 1, or the One Big Beautiful Bill Act, there were significant changes made to Medicaid regarding work requirements, cost sharing, and redeterminations. As a result, New Hampshire is in the process of passing legislation to align with this federal law. The work requirements apply just to the Granted Advantage program, and they do not apply to traditional Medicaid. Most people who receive Social Security disability are on traditional Medicaid and therefore would not be subject to these work requirements. However, if you are unsure of what program you are on, you can contact the New Hampshire Department of Health and Human Services to find out. There's also cost sharing for some enrollees, including the Granted Advantage and the CHIP programs, that will be enacted at some point in the future. We're not sure when this is going to happen. The Department of Health and Human Services passed the rules to initiate the CHIP premiums beginning in January. That still has not happened yet because what's going on at the federal level has not been settled. So we're not sure exactly when these are going to be rolled out. Additionally, under the current law, Medicaid eligibility is assessed on a yearly basis. Under new state and federal law, these redeterminations will be happening much more frequently and potentially every 4 months. Right now, it's an ever-evolving landscape, and the changes are going to be implemented over the next 2 years. Therefore, we recommend that anyone currently receiving Medicaid benefits should ensure that their contact information is up to date with the Department of Health and Human Services. So if they have any information, they know how to reach you. You can also visit the website that's referenced here on the slide, NewHampshireNeedsMedicaid.com, for more information. And again, we know that this uncertainty can lead to frustration, anxiety, and fear. And what you want to know is that we are here to answer any questions that you have, and we could provide the information as we receive it. We're following the changes to Medicaid very closely. Next slide, Sam. NAMI New Hampshire is nonpartisan. Mental illnesses and suicide affect individuals on all political parties equally. Simply put, they are nonpartisan. Likewise, NAMI New Hampshire is nonpartisan. NAMI New Hampshire collaborates with any and all stakeholders in all walks of life who have the shared goal of improving the lives of individuals affected by mental illness and suicide. Next slide, Sam.
Thank
And
you,
now
Holly.
I was going to say, now I'm going to turn it over to Sam to go over the 2026 legislative priorities.
Thanks, Holly. Yeah, so Holly and I are going to ping pong back and forth a little bit and really walk you through what the focus of our advocacy work is going to be during the 2026 New Hampshire legislative session. I just want to be clear in discussing these priorities that really the bulk of our work during session is engaging policymakers on the specific policies that are filed for that legislative session. Although we as an organization have a rather robust policy platform that we will discuss later, our year-to-year focus can really shift depending on the subjects that are included in the 1,000 to 1,200 bills that are filed by New Hampshire legislators each year. So for 2026, we've compiled this list of priority focuses based on the legislation that has been filed. It includes suicide prevention, youth and young adults, health access and coverage, justice involvement, involuntary treatment and hospitalization, and the social determinants of health. Before we start diving into specific bills, as we're just going to be giving a brief highlight of those policies tonight, I want to allow Holly to give a brief mention of our Public Policy Committee, which is a great opportunity to really learn more and get engaged if you're interested. You're muted, Holly.
Sorry about that. Let me start again. I was just saying, if you're ever bored on a Monday afternoon, the second Monday of the month, come join us at the Public Policy Committee to learn what NAMI New Hampshire is doing regarding policy matters. The committee is open to the public, and we meet every month, as I mentioned, on the second Monday from 3:30 until 5. You can come one time, you can come every time. It really is dependent on your schedule and what you have going on. You can feel free to drop in anytime you have a free Monday afternoon on the second Monday of the month. You can hear updates and provide input on NAMI New Hampshire's policy efforts. And to learn more, you can email us at advocacy@naminewhampshire.org.
Thank you. So our first priority area that we really want to focus in on is suicide prevention, which obviously is a huge cornerstone of our work. And that is because suicide really affects a lot of Granite Staters and their family and loved ones. Here in New Hampshire, suicide is the leading cause of death for young Granite Staters ages 10 to 14, and the second leading cause of death for those ages 15 to 34. So this session, we are engaging on quite a few pieces of suicide prevention legislation. The first of which that we want to talk about is a piece of legislation we are opposing that would roll back requirements for suicide prevention training for school personnel and staff. This is legislation that NAMI New Hampshire actually worked really hard to get in place in a prior session. It has very specific requirements as to how long the training has to be, and how frequently staff has to be trained again. And this legislation would roll back a lot of those requirements, which are pretty essential to keeping school staff and personnel well equipped to support students. Additionally, we are supporting policies that would create a mechanism to temporarily restrict access to lethal means for people who are in crisis. You may have heard these types of policies called before extreme risk protective orders. It essentially allows a family member or a household member to petition the court to temporarily remove firearms from that person who might be in crisis. Additionally, we are continuing to oppose policies that do negatively impact LGBTQ plus granite staters. Data continues to show an increased risk of suicidality, really due to the discriminatory policies and the harm that the LGBTQ plus community faces. Largely, these bills are similar bills to ones we've seen in previous sessions. You can see that long list of bill numbers there on the third bullet. These are all very similar bills to each other. This is the policy that would enable private institutions to start classifying facilities based on biological sex, so controlling what facilities and environments that transgender and non-binary people have access to. And a few of these bills would also require that classification in state buildings. This bill was once vetoed by Governor Sununu. It was also last session vetoed by Governor Ayotte, and we are hopeful that that will continue this year should any of these pass the legislature. And I will toss it back to Holly to discuss youth and young adult policy.
So as Susan mentioned, we are concerned about our youth and young adults here in New Hampshire because of the data that we've seen from the Youth Risk Behavior Survey about the high rates of our youth that are reporting feeling sad or hopeless, and the ones that have considered taking their lives. So we're following a number of bills, but these are the three most important bills that we've identified in this area. House Bill 1191 would limit, this is the one that Susan mentioned earlier about limiting the participation in the Youth Risk Behavior Survey, which would negatively impact crucial data on our youth in New Hampshire regarding mental health. It would make the survey an opt-in rather than an opt-out. And we know that with busy parents, it's easy for them to miss this critical opt-in opportunity, even when they would want their child to participate in the survey and want their child's data included. And therefore, it could render the important data on youth mental health and suicidal thoughts and behaviors unusable. House Bill 1688 would roll back existing restrictions on the use of restraint and seclusions in schools and treatment facilities, which could lead to an increase in the number of restraints and decrease the documentation of seclusions. It lessens the stringent requirement that a restraint not be used unless there is a substantial and imminent risk of serious bodily harm to simply imminent risk of bodily harm. It would also exclude the involuntary removal of a child from a stressful environment from the definition of seclusion so that those events would not need to be documented. And then Senate Bill 498 ensures access to coverage of fast forward wraparound services for the commercially insured New Hampshire youth and families. Currently, commercial insurers do not pay for any fast forward services. This bill would assess a small fee on all commercial insurers, and those funds would be used to pay for the fast forward services delivered to commercially insured youth. Back to you, Sam.
We continue to hear a lot from our community members and to experience in our own lives that mental health care can be really hard to find. It can also be incredibly difficult to afford. So with that in mind, continued advocacy around access to adequate coverage is really one of our key priorities for this legislative session and our future work. On this topic, we are working on several issues, the first of which has to do with parity around reimbursement rates for telemedicine services. Strengthening those parity requirements to make sure that telehealth is reimbursed at the same rate as in-office services. Although this is more obviously of a provider-focused bill, focusing in on this and getting these rates aligned will help support our workforce, which in turn does increase access for folks seeking care. Additionally, as we discussed earlier, there is a lot of legislation flying around right now that has to do with Medicaid. A lot of these bills are pretty complicated at this point, as there are certain conflicts between what was passed in the One Big Beautiful Bill in the federal government, as well as several bills and other policies that were passed last legislative session and in the 2026 to 2027 state budget. The bill we have included here is Senate Bill 484, which repeals the Medicaid expansion premiums that were included in the previous current state budget, and limits those cost sharing, the cost sharing for services for Medicaid enrollees at $5 per service. The federal legislation, I believe, allows that cost sharing to go up to $35 per service. This bill, if it were to pass, would limit that at $5. So we are seeing a couple of these bills that are trying to repeal some of these policies that specifically the state passed last year. But additionally, we are seeing a lot of bills that are going to be used to allow the legislature to adjust their policies to better align with federal policies. We're going to be very closely involved in these conversations and encouraging our policymakers to do as much as they can to lessen the burden on Medicaid enrollees here in New Hampshire. Finally, we are supporting Senate Bill 546 and similar policies that address network adequacy here in New Hampshire. So essentially, the goal of these bills is to assess under a health carrier and insurer's provider directory who's actually accepting patients, who's still accepting insurance, who's still practicing, to make sure that our networks aren't just healthy and adequate on paper, but that folks can really access care when they need it as quickly as they need it. I'll toss it back to Holly.
So we know that people with mental illness are overrepresented in our nation's jails and prisons, and this is also true of New Hampshire. So there's a couple of bills that we're working on around justice involvement. One of them is a holdover from last session. It's House Bill 480. It's the bill that would establish a state pilot program for a position of forensic liaison to facilitate competency restoration. Currently in New Hampshire, there is no formal competency restoration program, and as a result, it has a very low restoration rate. Competency is called into question when a person is involved in the criminal justice system, and due to their mental state, they are not able to understand the judicial process or assist in their own defense. If competency is not restored within a year, the charges are dropped. The person does not get their day in court, and they don't get any treatment. This bill is a great first step to establishing a competency restoration program in New Hampshire. And then House Bill 1067 would create a grant program to establish and strengthen and expand New Hampshire's mental health court system. Mental health courts are voluntary and alternative courts that help connect individuals with treatment and help prevent recidivism. Mental health courts can be life-changing for people with mental illness who become involved in the criminal justice system. They have been associated with reducing recidivism and incarceration and can even improve mental health outcomes. It would be beneficial to the state and Granite Staters with mental illness if mental health courts were more widely available throughout the state. I'll toss it back to you, Sam.
Nationwide, there has been an increase in conversations around involuntary treatment, and we are seeing some of those conversations turn into policy proposals within the New Hampshire legislature. So our next bucket is having bills that have to do with involuntary treatment and hospitalization. The first bill is one we are supporting, which is House Bill 1070. Currently, ambulance transfer for mental health evaluations or transportation around an involuntary emergency admission is possible, but it really rarely ever happens. More frequently, folks in crisis are restrained in the back of a law enforcement vehicle and taken to the next location, which we believe is really deeply traumatizing for these folks who are having one of the most challenging days of their life, and also increases the stigma around mental health for our entire community. So House Bill 1070 would help to address this issue by strengthening the requirements that instead of using a cop car, we are using an ambulance unless there's a real risk to safety there. Moving on, we are opposing House Bill 1372. This is a bill that would create a commission to essentially study establishing an additional state inpatient psychiatric hospital. Susan really addressed this earlier. We've been involved in this work for a long time around ED boarding and the inpatient capacity here in New Hampshire. And our problem really isn't those acute inpatient psychiatric beds. It's the beds and the resources in the community that help folks not reach level of care. So we are going to be going in opposing this bill, as we know that if this commission decides that that is the way to go, we we know that it's really not the way to go, and we've been having these conversations with partners in the state for a long time. So we will be opposing this bill. And then finally, a bill has been filed, the third bullet there, House Bill 1790, that would have substance use disorders qualify as a mental illness for the purposes of an involuntary emergency admission. This is obviously an incredibly complicated and nuanced issue that we are and we have been having extensive conversations with our community members and our partners and policymakers on. We understand really deeply the challenges of trying to get your loved one with a mental illness and a co-occurring substance use disorder care. We've also heard stories from folks of individuals who are in crisis, primarily from a mental illness, who go to the emergency department, but are then turned away because they've been using substances, which is tragic for them and their family. I apologize for switching the slide there. However, this is, as I mentioned, a really careful situation to consider because the research shows that involuntary treatment is really not greatly effective for substance use disorders. There's less evidence for it as there is for mental illness, for mental illnesses that are not substance use disorders, as active participation is a really crucial part of that recovery process for folks with a substance use disorder. Additionally, our other concern with this bill is that it does not provide a greater infrastructure for the state to treat these folks with co-occurring disorders. It only changes the legal eligibility for an involuntary emergency admission. So we do have concerns of whether or not the state would be able to deliver that quality care. So we're going to be really deeply involved in these conversations, working out these issues and working to help improve issues around practice for folks that have a mental illness and a co-occurring substance use disorder so that we can really help people reach the right treatment as quickly and as easily as possible.
And our last bucket of work that we're working on this session are the social determinants of health, because we know that the social determinants of health really play a role in mental health. So there's a few bills that have come forward that we are opposing. House Bill 348, it would allow municipalities to adopt burdensome requirements for individuals and families to qualify for and access local assistance. It would allow the municipalities to establish residency requirements of up to 90 days. So this would mean that someone who is discharged from a hospital or released from jail or prison in a different town than where they originally came from might not be able to get local assistance to help with housing, food, or medications. We're also opposing House Bill 1499. This bill expands the grounds for eviction, impacting individuals and families who have substance use disorders or with prior justice involvement. The bill allows for eviction due to the conviction of certain crimes, including the possession of narcotics, such as marijuana. A landlord can evict a tenant due to the criminal conviction despite it occurring prior to the tenancy beginning and despite the landlord knowing about it before making the decision to rent to the individual. Additionally, it allows for the eviction of every person who lives in the apartment or house, even if only one person has a criminal background. And lastly, we're opposing Senate Bill 615, which would limit the eligibility and use of benefits under the Supplemental Nutrition Assistance Program, otherwise known as SNAP. This bill removes the state's ability to grant categorical eligibility and to provide flexibility in work requirements and asset standards. We know that this will make it more difficult for individuals and their families to access necessary benefits, and it limits our capacity as a state to tailor the policies in response to the unique needs of Granite Staters. I'll toss it back to you, Sam.
Thank you, Holly. So that was really just a pretty quick glimpse, honestly, at the priority legislation we are working on. We are following about 100 to 150 bills that the legislature will be considering this session. We encourage folks to visit the Take Action page of our website at naminh.org/take-action to really learn more about the issues we're working on and get involved in our work. There, you can fill out a short advocacy form letting us know you're interested in getting involved, as well as sign up for our public policy alerts, which are weekly email alerts going out during the legislative session, informing you of upcoming mental health advocacy opportunities. You can also view the full list of bills we are tracking. You can read all of our testimony from this year all the way back to 2018, and you can explore our public policy platform, which is a longstanding document that explains the organization's position on several policy issues impacting mental health and suicide prevention. Finally, there are some great educational resources there to learn more about the New Hampshire legislature, as well as to share your interest in attending our advocacy trainings, including our annual It's Your Move advocacy training, which is held in the fall. We really do encourage folks to get involved. Your involvement is what makes our work possible. Your stories are essential to ensuring that policymakers make the right choices and build systems that serve Granite Staters who use them. And with that, I believe I'm turning back to Susan.
Thank you, Sam and Holly. Appreciate that's a lot of information to cover in a really short time. So we have our work cut out for us, obviously, in this session. And I just want to give a shout out. The session is well underway, and we've had a lot of folks who have responded to our weekly public policy alerts, shared their testimony, and reached out to legislators. And please keep at it. We're gonna be doing this right up until the beginning of June, folks. So just make sure you sign up for those public policy alerts and reach out anytime. So again, we all have a role to play here. We need to continue to, pound the drumbeat that mental health and substance misuse disorders are illnesses, and that these are things that impact every one of us, and that no one is immune. And so we need to continue to tell our stories about our own experiences, our lived experience, and advocate. We need to advocate. We need to make sure we have adequate funding for treatment, prevention, and research. We need to promote recovery-friendly workplaces and communities. We need to really, continue to promote peer support and all sorts of treatments. And then we really have to continue to remind folks that these are issues that we don't want to have in the shadows, that we want to have them front and center. Mental health is health, and we need to keep reminding folks about that. The story about bringing a casserole is an old NAMI story going back several NAMI national executive directors to when we have a loved one who has a serious illness, frequently, the community will organize a casserole brigade. But when your loved one is having a psychiatric hospitalization, often no one reaches out. So we want to make sure folks know they're not alone, care for each other, and just keep advocating. Next slide, Sam. I want to give a huge shout out to our over 200 statewide NAMI New Hampshire volunteers. Thanks to you, last year, NAMI New Hampshire served over 54,000 folks. I think back to our founder, Peggy Straw, who founded NAMI New Hampshire at her kitchen table some 45 years ago with 6 hurting families, in Peggy's words. Look how far we've come. And it's thanks to all of you. Truly, we are profoundly grateful. You are our lifeblood. So we look forward to continuing to work with you and growing and reaching out and helping more folks. Next slide, please. So save some dates here. Coming up quickly on March 10th is our annual virtual conference. It is free to register and registration is open. So please, mark the day. Most of the sessions will be recorded. So if you can't be there all day, you will have the opportunity to see them later. So please register. And then some other dates for you. May 7th, this is our 3rd year. We bring back This Is My Brave, where we will have 8 amazing storytellers share their stories of hope and recovery. That event sold out quickly the last couple of years, folks. It's in Concord at the Capitol Bank of New Hampshire stage, excuse me. And so, when those tickets go on sale, you're going to want to probably grab them if you want to attend. It will be recorded again as it was last year, and you can look on our YouTube page to see that. And then the Children's System of Care Magnified Voices Expressive Art Contest is currently taking submissions. This is for middle and high schoolers. It's amazing, so check it out. And then please save the date for our next NAMI Walks New Hampshire on Sunday, October 4th. It is free to register, and this year we had some 2,000 folks out there, and it was an amazing day. So it's a lot of fun. Please make sure you join us. Next slide, please. And I do want to take a moment to give a shout out to our NAMI Next Gen New Hampshire ambassadors. So we are thrilled to be bringing NAMI Next Gen here to New Hampshire, thanks to some support from NAMI National. And we have 5 young adults who have agreed to be our first cadre of NAMI Next Gen ambassadors here in New Hampshire. I think we've got 2 or 3 of them on with us tonight. So here are their handles on social. You want to check that out. They are, I believe, preparing a presentation for the conference. So again, another reason to register, and please follow along on social media and stay tuned. Our young people are just committed to busting stigma and promoting mental health. And so check it out. They are really amazing, fierce advocates. Next slide, please, Sam. And just a reminder, NAMI New Hampshire on our website, we have a vast amount of resources, well, a lot, I should say. And then we also offer our information and resource line, not a crisis line. We respond, we get back to you usually the same business day unless it's late in the day, so not on weekends and holidays, but it's an invaluable resource. It's also available for folks who speak Spanish. And it can help folks with accessing resources, getting support. So please share this. We're always looking to make sure that people understand that our information and resource line is available. Next slide, please. And very importantly, I always want to share crisis resources. 988 is the go-to, folks. It is available 24/7. And now with geo-routing, if you call 988, it will connect you with the closest crisis center. So meaning if you're in New Hampshire, you'll get a New Hampshire Crisis Center. And that's important because that will help you access mobile crisis teams here in New Hampshire. You can also reach them through this 833 number, the New Hampshire Rapid Response Access Point. You can call, text, or chat as well with both 988 and Rapid Response. Veterans Crisis Line is 988, press 1, and you'll be connected with a trained crisis counselor who is a veteran, has that lived experience. So really important resource. We were very disappointed when the federal government chose to end the LGBTQI option on 988, where you would press 3 to be able to be connected with those specific resources for LGBTQ youth. But the Trevor Project, our friends at the Trevor Project, continue to provide that service. So that's an important resource. And of course, we have additional crisis resources and a whole bunch on our website. So please check it out. Next slide, please. So just a reminder, here are some of the ways you can reach us. That's our general email, our 800 number, press 4 for our information and resource line, our website, and our Connect Suicide Prevention website. And then we are on a number of social media platforms, and you can follow us on your favorites and find our handles there on our website as well. So next slide, please. So these are somewhat unsettling times. I mean, here at NAMI New Hampshire, we had a whirlwind 36 hours last week when we found out our SAMHSA grant was terminated and abruptly, and then 36 hours later it was restored. This happened nationwide, which would have been devastating in terms of that impact here in our state and beyond. So we know very well that it's uncertain times. And we just want to remind you all that we are still here and you are not alone. We are not going anywhere. So please, if you need us, reach out, and remember 988 is available 24/7. I think that brings us to the end of our deck, and we have a little time for some questions.
Yes, I think we have a couple minutes to answer some questions here. So I will queue up some questions and we can try and get folks some answers. So the first question has to do with the Rural Health Transformation Program, specifically if there is going to be money in New Hampshire's plan for a crisis stabilization unit in Keene. I would add on to that question, just because of my own knowledge, really wondering when folks might be able to get a better idea of all of the different initiatives that will be included in the program.
Oh, great question. And I'm guessing that's coming from the leader of our Keene affiliate, Sharon Stout. And hello, Sharon. My understanding is, and really good question, Sam, because we still don't have the details on what the state's Rural Health Transformation Grant will include. We have been told it does include additional crisis resources, including crisis stabilization. Cannot answer the question as to where that would be. Certainly recognize that, there are locations like Keene in the state that have more challenges in terms of accessing the current 2 units that are available, one in Derry, one in Plymouth. So stay tuned. We will continue to advocate. We recognize that as an important resource statewide. There is a link on the Department of Health and Human Services website to see what they submitted for a narrative, but it's, I think, 30 pages long. It's $204 million. So it's really pretty high level. And we are all really interested in where this is going to land. As I said, the state will be submitting their budget by January 30th, their final budget, and we'll be getting approval. And that'll probably be mid-February. And I think then we're going to see a lot of stuff moving very rapidly. So stay tuned, and we will try to make sure that we are getting that out there in our e-news and on our social media as well.
Thank you, Susan. Our next question is coming from a person who is interested in joining our network of over 200 statewide volunteers. So if someone did want to join up with NAMI New Hampshire, where could they find out information about volunteer opportunities?
So we have a dedicated page on our website where you can see what opportunities are available and reach out in terms of and apply to become a NAMI New Hampshire volunteer. We do have a variety of roles, but we do have it pretty clearly delineated there on the website so folks can see what it is they would be interested in that we have the opportunities for right now.
And then I think we probably have time for one more question before I'll turn it over to Joe. How can folks learn more about the wealth of trainings that NAMI New Hampshire offers, sort of following the discussion of It's Your Move? Really, what trainings do we have, and what are they all in person? Are they all virtual? How can people really access these education programs and trainings?
Great question, because we have a variety of programs. You can see on our website that we will list upcoming trainings or education programs. And then we also have an e-learning platform where, yes, it's there are some that are self-paced, and then there are others that will be offered on a set time. They are virtual but live. And then we offer trainings around the state, and including our Connect Suicide Prevention trainings. Really great resources to sign up for our e-news, which comes out every other week. It has a huge amount of information in it. So if you go to our website, you can sign up for e-news, and that will keep you up to date on what kind of training and education opportunities are coming up. And it's a lot, actually. I also want to put this thing out there. If you unsubscribe from our email list, we can't then reach out to you. You have to resubscribe. So just if you're like, I don't like this one, just delete it. If you're like, I don't want to ever hear from you again, then unsubscribe. So just a word of caution.
And then I just want to grab the mic real quick and answer one last question that just came in that was essentially asking if there is any legislation or policies that are coming up this session that we plan to engage in that really will focus on supporting our providers in the community. We acknowledge the need for more resources in the community, but of course, the providers who are providing those services really need to be supported and be able to make a living, especially addressing reimbursement rates for groups and families and other billing for other specific services. So thank you very much for that question. That is a huge question that we are working to address, especially in work with our partners, and a lot of which include professional associations for behavioral health providers here in New Hampshire. I will say there are a handful of bills that absolutely have an impact on providers. Earlier, we discussed the telemedicine parity, which would definitely support our providers. There are also a few bills that are in the works that I believe are coming up later on this session that have to do with strengthening parity around billing for certain services, certain mental health services that currently are not billable, and we can absolutely provide more information on those bills as it becomes available. Anything else on that issue you maybe want to add, Holly?
I think the bills that you talked about regarding network adequacy, Sam, really support our providers as well, because if we are able to identify the ghost networks that we believe are currently in existence, it helps give our providers some more negotiating power in order to get into those networks. So those also do support our providers.
Thank you. And I think now I'll toss it over to Joe.
Thanks, Sam. This has been a fascinating hour, and it's been great to listen to all of the things that the organization is doing. I wanted to take a couple of minutes just to ask the panelists to talk about what keeps us going. What is it that gives us hope? And I'll start with myself. And I'll tell you, the thing that keeps me going and gives me hope is you folks, is the NAMI New Hampshire organization in particular. It's made up of people who are really talented and very hardworking. And despite all of the challenges we're facing, NAMI New Hampshire is in good shape. It's in good shape in a number of ways, and that gives me hope as we go forward. And the other thing that gives me hope is that things change over time, and there's a pendulum, and it will swing back. And I have confidence in good people doing good things. So that's what gives me hope. Um, let's hear from Holly. Holly, take a second and tell us what's keeping you going these days.
I think, really seeing the involvement of folks wanting to get involved in advocacy and have their voices heard. We've heard from so many people in the last few months that want to get involved and want to come to the State House. Sam and I were testifying on bills today and had two members of the public come and testify on two different bills. So it's really heartening to see people being willing to be brave enough to sit there in front of 20 to 25 people and open up and share their stories. And so that gives me hope.
Thank you. Thank you. And now, Sam, what keeps you going these days?
Holly's was actually a perfect segue into mine. I promise we didn't rehearse it, but I agree. Over the course of my work here at NAMI New Hampshire, the amount of helpers in our community has always brought me a lot of hope. But I would also say over the past year, part of what has really brought me hope is not just the people offering help, but the people asking for help. because we need both of those to actually accomplish what we're doing. The people who come forward and ask for support, I think is really essential. And I'm glad that we can all lean on each other like that.
That is so true. I mean, we've all, I don't know about you folks, but we've all had our moments in our family and in our personal lives where we really needed to reach out to other people. And so a lot of times the people who have been helped are the ones who turn around and help others. So it goes around. We'll wind up with you, Susan. Go ahead. You take it home, as they
All
say.
right. Thanks, Joe. So, what gives me hope is, it's all of you, but I want to particularly bring it back to last week and the termination abruptly of those federal SAMHSA dollars that was like whiplash being rescinded 36 hours later. I heard from so many of you, and it was a wild time, and yet you were all reaching out, and then you all started reaching out to your the federal delegation and telling them how important it was that these funds were available to support mental health services in New Hampshire, not just NAMI New Hampshire. And it was a really challenging 36 hours. But you fueled me. So thank you. Thank you all. And you did it. They did rescind those terminations. So well done. Again, keep making noise and keep advocating. So thank you all for joining us tonight. Incredibly grateful for you. Remember, the link to the recording and resources will be shared with all registrants. And please, folks, go forth, keep doing those good deeds, and please take good care. Remember, we're not going anywhere, and you're not alone.